Hello, my name's Scott MacDougall. I'm a mental health therapist with Alberta Health Services, Psychiatry Unit in St. Paul, Alberta. Started my career at ADAC in 1988 and moved to mental health in 1990. You know, when I came into HSAA, it was still considering itself an association, not unlike the nurses had years before. During my time, we did shift up and actually start calling ourselves a union. I recall presenting the principles of unionism to the convention that year, and again expecting maybe there'd be some pushback on that, and virtually all hands went up, say, yeah, I'm wanting to do that. So that was I think a significant shift in languaging, and also then setting the direction for building that unionism, what that is. I would say the first big fight was the Redford's government attack on pensions, and I recall standing in Edmonton at -30 with a square full of unionists from multiple disciplines, multiple unions, and providing that pushback effort that, fortunately we were successful. But it was an invigorating period of time to see people taking their contract seriously, taking themselves seriously, being willing to put themselves out there and use that collective strength of solidarity as working people to say, no, this isn't going to happen. And it didn't, Again, I mean, I think my career has spanned all the difficult humans that have tried to gut the public service from the beginning of it to the end of it now. With the billions of dollars literally pulled out of healthcare, and the expectation that the system is going to do more with less on a regular basis. That's been a steady theme throughout mine. I think the main thing for me, honestly, is, and hope, is that folks embrace the idea of solidarity. It's problematic sometimes for professionals, for tech-trained folks, to see themselves as working people. But realistically, if we don't own something, we're selling our time for money. And that consciousness, that coming into solidarity and understanding that this is where our power lies as working people. It doesn't matter what our work is. It doesn't matter that we're professionals. We're working people. And I think we run the risk of being picked off, kind of groups or individuals at a time, unless we can really wrap our minds around the strength that coming together in a union context offers us all, and the protection. Well, I'd like to really see it being able to, flex its 27,000 member muscle by knowing that, virtually each one of those 27,000 members is willing to show up on any given day to push back against injustice, inequality, unfair treatment, abuse in the workplace, all of those things that are our reason for being in the first place. And again, I think it sort of goes back to as people fully appreciate the value of solidarity, beyond it being just a word, that it has to have an action component. I have to be engaged in it. That would be my hope for HSA and other unions, quite frankly.